What do you want to study? Roku. Press BiOSTATICS. Hi, it's Naplex time. We're looking at biostats and seeing the difference between case control and cohort so we can choose the correct study. So what we're doing is writing out case control versus cohort, and I take the values of case control and I take the values of cohort. So for case control, I have the A and the O, and for cohort, I have two O's for the vowels. That's our trick. The A's and the O's represent how we start the study. So if we have two groups in case control, the A and the O actually represent two different groups. And the two O's in cohort are similar groups. So that's how they're starting the study. And if there is an A, that represents a group that has the disease. And if there's an O, that represents the group that does not have the disease. We have an A and an O. The two groups are not starting out the same. One group has the disease and they're labeled A. We can look back in time. That's why we have an arrow going to the left. We're retrospective. We're looking back in time for a case control study. It is less reliable than cohort. Cohort can do anything case control can do plus more. Cohort is starting out with two groups that are the same. Neither of them have the disease. We do have an arrow going to the left because it can be retrospective, looking back in time, because it can do anything case control can do. But it can also look into the future. Nobody's starting out with the disease, but we will ask the question, who will get the disease for cohort? We have a prospective study as well. And if we have both prospective and retrospective, then we call that a longitudinal study. For case control, we look back in time and we ask what exposure caused the disease. On the other hand, for cohort, we ask who will get the disease. Going back to case control, we use odds ratio. For cohort, we can use relative risk or odds ratio. And the ways that we can remember that is that odds ratio is odd. The A and the O that we had for case control are different from one another. They're odd, so we can use odds ratio. And the trick for relative risk is that the O's in cohort are similar to each other, just like relatives. Now look at some studies and see if you can tell the difference between case control and cohort. Let's try this example. Take a moment and pause. It is actually cohort. It is cohort. And the reason is case control can look back in time, but cohort can look back in time. It can do anything case control can do, but it can also do more. It can look into the future. And in this case, everybody is starting out the same, just like the two O's. So they're all starting out without any respiratory symptoms. But then we're going to give them exposure. We're going to give them exposure to pet dogs. And then we're going to say, okay, who develops the disease? Who develops the respiratory symptoms? So it's actually cohort because we're looking into the future. We see some terms there that could help future tense. Studies will be performed at the onset of respiratory symptoms. So we're looking into the future. We're starting out with two groups who do not have the disease to begin with. We expose them to a pet dog, and then we ask ourselves who will get the disease. So that is cohort. What do you want to study? Roku. Press BiOSTATICS.